Hello, my name is Lisa Elizabeth Maffey, and I would like to introduce you to my poster presentation. My scholarly practice project is on sudden unexpected death in epilepsy, or Sudep. The purpose of my project is to educate adult patients with epilepsy about their seizure reduction in the context of safety and their risk for sudden unexpected death in epilepsy. This is done using a validated checklist tool called the Sudep and Seizure Safety Checklist, as well as a research-developed, patient-directed educational module on seizure reduction and information on Sudep. My research question: does implementing an educational intervention to motivate adult patients with epilepsy about risk factors for Sudep based on an innovative checklist increase the self-determination concepts of motivation and competency? Why is Sudep important? 1 in 26 adults in the United States will go on to develop epilepsy annually. It is the most common neurological disease. Sudep is a leading cause of death in persons with epilepsy. In the US, 3,000 people, those living with epilepsy, will die of sudden unexpected death in epilepsy each year. The incidence of sudden death among young people ages 20 to 40 living with epilepsy is 24 to 27 times higher than that of the general population. The American Academy of Neurology, in combination with the American Epilepsy Society, co-sponsored written guidelines discussing how to approach the topic of sudden unexpected death in epilepsy with patients. These guidelines were published in 2017, yet research continues to show that persons with epilepsy and their families do not know about Sudep. Sudep is not routinely discussed with them, yet research continues to show that most patients want to be told about all risks in epilepsy, including and most importantly, their risk of dying. This study is a quasi-experimental one-group pre-test, post-test design. The self-determination theory and its concepts of motivation and competency will be measured. These will be measured using 2 surveys. The multi-dimensional health locus of control is an 18-item Likert scale survey, looking at whether one is internally motivated or externally motivated. Many studies show that patients who are internally motivated have better health outcomes. The second Likert scale used is a 38-item epilepsy self-management scale, a well-researched, validated tool that looks at the ability to self-manage one's own behaviors as it relates to living well with epilepsy. The evidence-based model used for this project is the evidence-based practice improvement, the EBPI, or most commonly known as the PDSA model of improvement, the Plan, Do, Study, Act. 34 patients from an adult outpatient epilepsy clinic will be recruited. This is using a convenient sample of patients who have upcoming appointments with the mentor neurologist on this study. Prior to this clinic appointment, the 2 surveys will be sent out. The patients will come in for the clinic appointment and the Sudep and Seizure Safety Checklist, which is an 18-item tool. 12 of these items are considered to be modifiable, but this tool will be presented to the patient and their risk factors will be outlined for them if there are any. 0 is a score for no risk factors, 1 is a score for risk factors. And then immediately following that clinic appointment, the patient will view the educational module on seizure reduction and Sudep education. This module was specifically designed to give patients control over which topics they view first. Sudden unexpected death in epilepsy discussion can bring about anxiety in patients and their families. However, this is not a reason for why it shouldn't be discussed as part of the overall management of epilepsy care. So this module that I designed allows the patient to choose which topic to view first. And different topics are living well with epilepsy, ways to reduce your seizure risk, and education on Sudep. And this is taken from a world-renowned epileptologist, an interview with him. So allowing patients to have that choice over which module to look at first may reduce some of that anxiety. My beginning narrative, which is about 30 seconds before they view the module, tells them that I would like them to view all topics of the module, but that they can choose which ones they go to first. The outcomes of this study, statistical analysis will be done using descriptive statistics, allowing for mean age, rates, and percentages that describe the sample population as that compares to the general population. And a frequency count and percentage will be performed around gender, ethnicity, highest level of education, and seizure type. Seizure type is important here because one of the most risk factors for sudden unexpected death in epilepsy is having convulsive or old term grand mal seizures, and if those are happening at night or nocturnally. So my hope is that by using t-test to measure the pre and post changes from the Likert scales after the intervention, I may have a subscale of patients to look at who are most at risk for Sudep, and their changes in both internal motivation and competency may be the highest, given that their risks are the highest. The goal of this study is that there will be a significant change or increase in the self-determination concepts of internal motivation and competency following the pre and post surveys. My next steps to disseminate this poster presentation is already in action. The American Epilepsy Society, of which I am a member, has its annual conference in December. And in December of 2022 is when I hope to present this. The summer preceding that, AES sends out calls for poster presentations. And so I will be applying for that. The second way to disseminate this poster presentation on my scholarly project is through Sudep Action, which is the United Kingdom equivalent of the American Epilepsy Foundation here in the United States. Sudep Action is the proprietor and developer and owner of the Sudep and Seizure Safety Checklist. I have met with them multiple times virtually to gain invaluable insight into how to design this study in the ways that their published studies have helped thousands of patients identify their Sudep risk and possibly reduce it. So I would like to present this to Sudep Action sometime in 2022. Thank you.